Hello everyone. I will shortly talk about penoscrotal web because it is a topic that kind of misunderstood and abused. Penoscrotal web is the skin that begins from the head of the penis and goes to testicles. It is an excess skin, actually. What does it cause? Well, first of all, it causes penis to look short, and secondly, it makes it difficult to have intercourse. Penis needs to be in shape to enter a vagina. When there is an excess skin that looks like a dog's web foot or bat wings, it is difficult for penis to enter. The biggest criteria for surgery is this. Does it make it difficult to have intercourse? A patient can have penoscrotal web, but if it is not making it difficult to have an intercourse, then surgery is not a necessity. Problem here is this. More than the half of the patients that came to us say, I have penoscrotal web. So we look for it during examination, but there is no such thing. We say take pictures during erection, and there is no such thing either. Why is patient mistaken? Testicle skin under the penis is kind of loose, so when you gently pull it, it looks like you have penoscrotal web. So when a patient sees this loose skin, he thinks he has penoscrotal web. However, he has not. Like I said, the biggest criteria is whether it makes it difficult to have intercourse or not. We ask the patient, do you have difficulties during intercourse? Does this piece of skin get caught during the penetration of the penis into vagina? He says no. Then you don't have penoscrotal web. That's it. Why is the surgery abused? Because unfortunately doctors say every patient that they have penoscrotal web and that they need surgery. They perform an unnecessary Z-plasty, and this makes no difference between before and after of the surgery. Or they say that they perform elongation without cutting the suspensory ligament. This is something miracle. Apparently, they can elongate penis without cutting the suspensory ligament. What is he doing? He performs a Z-plasty as if there is a penoscrotal web. And then what? Penis is elongated. This is completely illogical and utterly nonsense. These patients are abused due to their misinformation and misunderstanding about the concept. Patient thinks he has penoscrotal web and comes to you and you say we can perform a Z-plasty and elongate your penis. There is no such thing as 1 millimeter elongation be performed. Please stop this nonsense. You cannot slide at the penis tissue without cutting the suspensory ligament at the bottom of the penis. This is like seeing a tied up dog to a pole and saying, I can take this dog for a walk without untying it. How can you take this dog for a walk without untying it? It is not possible. You cannot elongate the penis without cutting the suspensory ligament. It cannot move. That's why there cannot be even 1 millimeter elongation. If there is a penoscrotal web under the penis, you can only fix that. It can look as if elongated, but there is no real elongation, not even 1 millimeter, because you need to cut the suspensory ligament. There are even worse cases. For example, although a patient does not have penoscrotal web, they perform a Z-plasty claiming that they can elongate the penis. Utterly nonsense. Penoscrotal web does exist in maybe 10 or 20, 1 in 10 or 20 patients. When I see a penoscrotal web, I get surprised. I'm like, wow, that's really a penoscrotal web. Let's fix this. I say we can fix the appearance, the web foot appearance, but elongation of the penis cannot be achieved, not even 1 millimeter long. If a patient wants to elongate his penis, we also fix the penoscrotal web while doing so. Fixing the penoscrotal web does not mean elongation because it will not result in elongation. But unfortunately, when a patient goes to a doctor, they say, we do not cut the suspensor ligament, it is safe. There is nothing wrong with cutting the suspensor ligament. They abuse this fear of the patient also. This is pure abuse. Let's name it. There are no vessels or tendons in the suspensor ligament. There is a very thin vein at the bottom of it, except that there are no vessels or tendons. There will be no lowness or sensation loss in the penis, and erection will not be disrupted. Cutting the suspensor ligament is the safest part of penis elongation surgery, but the patients are scared, and there are doctors that abuse these fears of patients. Unfortunately, I don't want to talk like this about some of my colleagues, but this is the fact of the industry, to be very honest with you. If we are honestly talking about the penoscrotal web, I have to say this too. If they say we can perform Z-plasty and elongate your penis when you go to doctor with the fears of penoscrotal web, just know that this is complete nonsense. Z-plasty that performed under the penis is effective when there is penoscrotal web. If there is no excess skin that makes it hard to have an intercourse, then there is no penoscrotal web. Let me say that too. If you don't have penoscrotal web, do not get anything done on the penis or testicles because they will not result in anything. Only result is that you would be taking unnecessary risks. Every surgery carries a certain risk. Open stitches, infections, bleeding, etc. I think medical operations should not be performed unnecessarily. Apart from that, there is one thing I want to say on penoscrotal web. When removing penoscrotal web, it has to be removed in compliance with the medical techniques. Urologists perform it different than plastic surgeons. By saying urologists, there are some foreign urologists, American urologists, they perform it very incorrectly. When I see some of their videos, I even thought to write some notes under them, but I just let it go in order not to irritate them. He cuts penoscrotal web linearly, just like that, bam, bam, bam, and stitch it. This is wrong. If you remove penoscrotal web just like that, it reoccurs because that linear stitch line gets contracted in time. Penoscrotal web reoccurs just the same as before because stitch line gets shorter. Then you cut and remove it just like that and stitch it linearly. And do you know what happens when it gets contracted? Mark gets shorter and it results in web again. Penoscrotal web needs to be removed with Z-plasty. It needs to be in zigzag. We don't make stitches 10 centimeters long for nothing. Stitch line gets longer because of zigzags. It takes more time to stitch, but this is the correct way. Stitches in that area has to be in zigzag. Plastic surgeons do zigzags, but urologists, the American urologists that I saw on the YouTube videos always do it linearly. That's wrong. Patient is going to come back to you after 9 or 6 months saying that his penoscrotal web is reoccurring. It needs to be removed with Z-plasty and zigzags. This is not a complex issue, but just like I said, it gets abused and patients think that they have it even if they don't. I wanted to talk about that, but there are no further details. Maintenance and care is important after surgery. If the patient is coming from abroad or far places, we made him stay one night at our hospital because stitches on the testicles generally can cause bleeding. He stays at the hospital overnight and the next morning we make medical dressing and then discharge him. We do this on testicle prosthesis or when fixing descended testicles. On operation related to testicles, our patient stays at hospital for one night and the next morning we discharge him after dressing. I wanted to talk about this shortly. Thank you for watching. I may sound kind of aggressive, but this is seriously frustrates me. Abuse of the fears of the patients is what makes me angry. So what I'm asking for from patient is that please do your research and learn before you take an action. Thank you again for watching.
Numaralara gelmeyin lütfen. İzlediğiniz için teşekkür ederim.